Okay, hello everyone. Good afternoon to all of you. Yeah, all of you, I think basically means that those who are in the webinar and also those in the hall as well. So this is our first concurrent classroom that organized by the UKM. By the way, my name is Yong, and call me Ming Sen. Yeah, the lecturer and also the ophthalmologist from the UKM. So I think all of you will know the purpose of you to be here to listen to the dialogue on neuro-ophthalmology, the approach on the optic neuritis. So before start the main topics, we are very fortunate to have the support from our industrial partner, the DKSH and also TRB. So we would like to start today's sections with the two sponsored drug talk first. So first will be from the DKSH with the title of Preservation of Visions with Preservative-Free Antibiotic.
Representative from DKSH. Thanks for allowing 20 minutes sharing. So I hope you had a good lunch. Let's start. Patients with cataract, they have blurred vision like this. And patients also may have this vision after the cataract surgery if the complications develop. So today our topic is on preservation of vision after cataract surgery with preservative-free antibiotics. As we all know, cataract happens when the cloudiness of the lens develops. This is because the light, when it goes into the eyes, it cannot be focused at one point, and it will scatter at the layer of the retina. I can hear some doctors that have been explaining to their Chinese patients when they have cataract, they call mock. So doctors also will tell patients the development of cataract is a natural process related to aging. With increasing aging, the weight of the lens, the thickness, that will increase, while the transparency of the lens, that will decrease. Day in, day out. So you may see a patient with cataract, they walk in with this eye condition. Patient with cataract, then they walk into clinic and complain to doctor, can see the image blur, and also they can see halos in the light, and even some patients they see double vision. Older people with a visual impairment, usually they will report to feeling dizzy and also falling. This has shows cataract has deeply impacted the patient's normal daily life. Statistics shows there are 120,000 cataract patients in Malaysia at year 2017, and this number will increase threefold to 2050. It may be because of Malaysian, we are aging. Every surgeries that associate with complications. These are some complications developed after cataract surgery. Endophthalmitis is one of the complications of cataract surgery. It is post-surgical infection. For the common organism that causes endophthalmitis, it can normally found in the flora, in the normal flora. However, when bacteria that goes into the eyes and causes infection, that's become the most devastating complications of intraocular surgeries. This is an eye condition your patient may present to you when they have endophthalmitis. Patient may complain about pain, redness, swollen, hypopyon, and some patients may have vision loss. Good news is, endophthalmitis it can be prevented with prophylactic antibiotics. Vigamox is a topical antibiotics. It can help patients to prevent the infections after surgeries for the reason of first, Vigamox has a low resistance rate. As we all know, antibiotic resistance it remains a challenge for doctors. because antibiotic resistance may lead to a longer illness and treatment and also increase the medical cost. Look at the study, focus. This is to evaluate the pharmacodynamics of antibiotics of fluoroquinolones group on Streptococcus pneumonia. So they have included two generations of fluoroquinolones. Fourth generation fluoroquinolones is moxifloxacin, which is Vidamox, and they're also using third generations of fluoroquinolones, which is levofloxacin. So on the upper graph, it is to show the bacterial count is low, and the lower graph it shows when the bacterial count is high. So it shows using levofloxacin is effective when the bacterial count is low. While if the bacterial count is high, levofloxacin they are not effective to inhibit the growth of the bacteria, because you can see the line with the dot and the line with the angle is still moving up. On the other hand, using moxifloxacin, you can see the line with the square. Regardless of the bacterial count is low or high, you still can see it is effective to inhibit the growth of the bacteria. Remove the organism of Streptococcus pneumonia resistant strain. So in the bacterial count is low or high, you still can see levofloxacin. It is not able to inhibit the growth of the bacteria. By using moxifloxacin, regardless the bacterial count, it is able to achieve the efficacy to reduce, to inhibit the growth of the bacteria. In summary, moxifloxacin that has a lower resistance to be compared with the third generation fluoroquinolones levofloxacin. This is because the structure of the fourth generation of fluoroquinolones they have a BAP-C7 type chain. So it is to inhibit the extract bacterial extract pump. It means it can help the drug to stay in the bacterial cell for a longer time. So it helps to improve the potency and also further inhibit the resistance. Next, Vidamox is a bactericidal and it is a broad. So Vidamox is a broad spectrum, so it covers most of the gram-positive and also gram-negative that causing endophthalmitis. And also it is bactericidal. It is one of the ways to reduce the mutant because compared to the bacteriostatics, it's only inhibit the growth, but they still have potential to mutate. Vidamox also shows excellent penetration in the aqueous fluid. First, this small study they have measured the concentration of the drug in the aqueous fluid before cataract surgery. So that has included fourth generation fluoroquinolones, Vidamox, and also third generations fluoroquinolones is a levofloxacin. So it shows Vidamox they can achieve better concentration in aqueous fluid. They are 1.4 times higher compared to levofloxacin. The other study key that evaluate the penetrations of the drug into aqueous fluid comparing moxifloxacin with gedifloxacin. So it shows Vidamox they have 3.8 times higher concentration compared to gedifloxacin. Next, let's look at effective of the drug. As we all know, antibiotics we can measure the efficacy with its MIC, MPC, and also MPC. And antibiotics they are more potent when the MIC, MPC, and MPC is lower. This is a chart effective from study on bacteria. So you can see the MIC for levofloxacin versus gedifloxacin and also moxifloxacin for the organism that's commonly caused endophthalmitis. Vidamox having the lowest MIC compared to levofloxacin and gedifloxacin for all the organisms. bar chart, you can see the red bar is used Vigamox. This is the MIC value for the organism of fluoroquinolones resistant strain of aureus. So blue bar is for level processing. Overall, the bar of the level processing, they are taller, they are higher because they have higher MIC value. So when we put in the concentrations, level processing, they can penetrate to the aqueous humor and achieve a penetration at 1.34 micrograms per milliliter. So it shows that it's not able to inhibit, it shows that it's unable to achieve the MIC for all the pathogens. However, MOXIE processing, you can see it can penetrate within the aqueous humor and it can exceed all the MIC value for all the organisms that's commonly cause endophthalmitis. This is a comparison using GATI processing and also MOXIE processing. You can see the red bar is lower than the orange because the MIC value for MOXIE processing is lower than GATI processing. We put in the concentration. GATI processing, they are unable to inhibit the growth because they're not achieving the MIC value of these key pathogens. MOXIE processing is excellent because it's able to achieve the MIC value for most of the organisms. Last but not the least, we look at the tolerability of Vigamox because we know that's equally important to have. This is to evaluate the tolerability of Vigamox. So it shows number of the patients that have been ocular discomfort either using Vigamox or patient broke vehicle, they are almost the same. In conclusion, MOXIE processing or Vigamox, it is well tolerated by patients. We come to the summary of Vigamox. Vigamox is a broad spectrum bactericidal, so it can cover most of the gram-positive, gram-negative, and also endophthalmitis. Vigamox have a high potency because it shows they have a lower MIC value for most of the organism pathogens that cause endophthalmitis. Vigamox is well tolerated by patients because of its acidity and also the pH is near to the nutrient. And last but not the least, Vigamox have demonstrate an excellent penetration into aqueous tube. This is a quick reminder for Vigamox indication. There are two. First, Vigamox is indicated for patients 1 year old and above with bacterial conjunctivitis. Second, Vigamox is indicated for pre-operative and post-operative sterilization. The usage of Vigamox is for bacterial conjunctivitis is 3 times daily for 7 days. Indications dosing for pre-op and post-op sterilization is 5 times per day before the operation and 3 times after surgery. Like the ends, today I'm sharing with the quote of Dr. Salome. Blind people do not come by percentage, hundreds, thousands, or millions. They come by person. How many is considered too many? 1 blind person is too many. Thank you for your attention. Doctor, if you have any medical inquiries, you may contact me at this number or this email address. Thank you. Wish you have a nice day. Bye.
Thank you very much to Fatima for the well-prepared and also presentations. Even you are not here, but I believe you are listening somewhere else. Okay. So we move to the next speaker from the TRP Chemedica. We'd like to invite Ms. Yuin, the product manager and also the pharmacist by professions, to deliver her talk on Wismed, more than meets the eye.
Thank you, Dr. Yong, for the kind introduction. Okay, my name is Lee. All right, I'm from TRP Chemedica. All right, a Switzerland company. So thanks for having us today. Okay, so basically our topic today will be very simple, all right? So Wismet more than meets the eye. So what we're really trying to say is that Wismet is not really as simple as it is, all right? So there's some features which I will later show you, okay? So yeah, first, of course, we'll talk about dry eye, all right? Simple dry eye, but actually what exactly is a definition? If according to this T4-2 definition, okay, which is from the Tear Film and Ocular Society, Ocular Surface Society, sorry, dry eye workshop, okay, they actually define dry eye as a multifactorial disease, okay, of ocular surface, which characterized by a loss of homeostasis of the tear film and often accompanied by, of course, ocular symptoms, in which tear film instability and most importantly, hyperosmolarity, okay, and ocular surface inflammation and damage, and as well as neurosensory abnormalities plays an etiological role, right? Okay. So in fact, osmolarity is actually a very good tool, okay, for us to diagnose dry eye. But the problem is, of course, it's not cheap, okay, to use an osmometer. However, this is at least for our information. For a normal healthy subject, all right, our normal osmolarity is around 300 milliosmol per liter, right? So as the osmolarity increases, okay, so as the severity of the dry eye. So normally for patients with moderate to severe dry eye, their osmolarity can be up to 350 and so on, all right? So this brings us to another question. So what exactly is tear hyperosmolarity? Because in the definition itself, it mentioned hyperosmolarity actually plays an important role, okay? So if you look at this article by Bourdain, looking at the role of hyperosmolarity in the pathogenesis and management of dry eye disease, you can see that tear hyperosmolarity is actually a state in which the osmolarity of the tear actually exceeds to that of the epithelial cell, okay, which leads to reduced cell volume as well as increased concentration of the solute, all right? And in fact, he actually proposed this mechanism of dry eye, where initially, okay, of course, it started with tear film instability. You can see, oh, cannot, never mind. So it started with tear film instability, I believe you can see, all right, and which leads to, okay. So it started with tear film instability, which later leads to tear film, tear hyperosmolarity, all right? So with tear hyperosmolarity, okay, the cell will be very desiccated, okay, which later leads to cell damage as well as apoptosis, okay, of conjunctiva and cornea, all right, and later inflammation and eventually goblet cell loss. So with the goblet cell loss, the production of mucin will also be affected. So in a way, it will cause instability of the tear film again. So it perpetuates the cycle, all right? And this concept, all right, or this cycle is actually consistent with a separate article, okay, looking at the vicious circle of dry eye disease, but then focus on the pathophysiology of NGD, all right? So this is actually the double vicious circle they proposed, all right? So if you look at this, okay, I'll enlarge this for better elaboration, all right? So with meibomian gland blockage, okay, so the meibum we have a stasis of meibum, all right, so the meibum stuck there, all right, so it will encourage the proliferation of bacteria as well as mites, all right, because they want to feed on the meibum itself. So in a way, they also secrete lipase and esterases and then increase the melting point and then worsen the cycle again, okay, and of course, in this case, just for information, we have a product called Azita, which is azithromycin eye drop, all right, so 1.5%. Interestingly, because azithromycin is a macrolide, all right, second generation macrolide, they actually have this property of antibacterial as well as anti-inflammatory. So this actually gives them an edge in this management, okay, of this condition, okay. And of course, we are preservative free as well, okay. So something like also a preservative free formulation to preserve your vision, all right. Okay. But of course, today our main topic is not Azita. Okay, I'll move on to the dry eye disease cycle. So again, with the meibomian gland blockage, so the lipid layer will actually be affected. Okay, so when there's less production of lipid, excessive evaporation of tears will happen, and that's when tear hyperosmolarity occurs. And followed by inflammation, and of course, the author proposed later there will be keratinization of the meibomian gland or orifices, and again, it contributes to the cycle again, all right? And of course, in this case, Bismuth actually helps in the hyperosmolarity as well as the inflammation, okay? All right. And of course, then our next question would be, well, how do I choose between a hypotonic formulation or an isotonic formulation? Okay, what's the difference, all right? So if you look at, okay, so I'll share with you some of the literature. So if you look at this study by Aragona, okay, looking at the sodium hyaluronate eye drop in different osmolarity, of different osmolarity, and how's the outcome, okay, in treating dry eye in the patient with Sjogren's syndrome, okay. You can see the conclusion here, okay. They actually propose that the formulation with pronounced hypotonicity, hypotonic, okay, actually show better effect in terms of corneal conjunctival epithelium than that of an isotonic solution, okay. So this is actually the outcome, all right. Of course, group 1 is hypotonic, okay, the one here, and the one shaded in black is group 2, which is isotonic. So if you look at the corneal stain, okay, they use fluorescent staining. You can see overall, okay, of course they take a reading on day 0, day 5, 15, 30, and 19. You can see on day 15, overall you can see the staining on the in a group of hypotonic sodium hyaluronate, they actually have less staining. And significantly, a significant difference is actually observed on day 15. This is actually for the fluorescent staining, all right? And in terms of rose bangle staining, okay, when you look at the conjunctiva, okay, you can see again, overall, at all time points, okay, the hypotonic formulation actually gives a lesser staining, right, as compared to the isotonic. And you can see this, in this case, most of the time point, they are significantly different, right? All right, and the outcome is actually consistent in a separate study. Okay, this is by Yingli. All right, looking at hypotonic and isotonic. Okay, comparing these two, 0.3% of sodium hyaluronate. Right, and again you can see in terms of the corneal staining. All right, okay. Again, the black color is actually the black color bar is actually hypotonic. Okay, you can see on day 5 and day 10 itself, in both day 5 and day 10, the hypotonic sodium hyaluronate actually has a lower fluorescent staining as compared to the isotonic. All right, and when we take a picture, okay, of the rabbits, all right, then they notice that, as you can see, maybe not very clear over here, but actually the hypotonic has the least staining, right? Okay. And in another aspect is the inflammation, okay? So when you look at the concentration of inflammatory mediators, so you can see over here, you can see the control, all right? So overall, normally the amount is something like this, okay? If you can see, with the use of isotonic sodium hyaluronate, because sodium hyaluronate itself is an antioxidant, okay, they actually can, anti-inflammatory, so they actually can reduce the number of inflammatory cells. But if you use a hypotonic sodium hyaluronate, they can reduce the inflammatory cytokines even better, all right, even more. Another thing is looking at the goblet cell density. Okay, they use the period acid shift stain. Right. Again, you can see the one with hypotonic formulation actually has a higher goblet cell density. So with this, the author actually had this drew this conclusion saying that hypotonic eye drops, okay, sodium hyaluronate eye drops, can be more effective in first improving the corneal staining, okay, score. Okay. Second is the inflammatory, decreasing inflammatory molecule, and lastly, increasing the goblet cells count in experimental dry eye. Okay. For this, I just show you this just to let you know, because I wanted to find a study to show you the difference between a hypotonic and an isotonic formulation and how they can affect the tear osmolarity. So if you look at this, okay, if a patient has dry eye, this is actually the osmolarity on the y-axis, all right? Okay, so you can see it started with around 350, slightly less than 360, okay, the osmolarity. So with the use of hypotonic formulation like Bismuth, okay, which is a blue one, as compared to isotonic formulation, you can see a hypotonic formulation can actually assist to restore, okay, the osmolarity back to normal, which is around 300. At least this is in about 15 days, okay, and 30 minutes after installation, right? All right. Then our next discussion would be sodium hyaluronate, because I believe sodium hyaluronate nowadays is very popular, all right? Okay, but what is really the rationale behind of us choosing sodium hyaluronate? I mean, why everyone wants to use sodium hyaluronate? Right? So one of the proposal of the action is that if you look at this, okay, they actually propose that sodium hyaluronate, because they can promote the migration of corneal epithelial cell. That's why they can help in wound healing. All right. If you look at this, the conclusions, okay, the author actually mentioned the beneficial effect of sodium hyaluronate in corneal wound healing is very likely to be related to the rapid migration of corneal epithelial cell, which leads to a rapid wound closure. Okay. And in fact, of course, this is actually an in vitro study, all right? In fact, the outcome is actually supported by a clinical clinical study. If you look at this study, looking at the use of commercially available sodium hyaluronate 0.18% for the corneal epithelial healing in diabetic patients, they notice that the use of sodium hyaluronate actually can assist wound healing in diabetic patients, right? So if you look at this outcome, of course, for the first line is non-diabetic patient, healthy patient. So for a non-diabetic patient, normally for them to achieve a complete wound closure after a surgery, maybe is around after 48 hours, right? However, if a patient has diabetes, right, so the wound healing may be slightly slower. So you can see on the DMC, the control group of diabetes, without using any sodium hyaluronate, you can see they actually need up to about more than 120 hours, okay, to achieve complete wound closure. Okay. However, when they use sodium hyaluronate eye drop, which is the third group, diabetic with Wismet, DMV, okay, you can see the wound recovery actually was quickened, all right, and they achieved complete wound closure after 60 hours, right? So with this, of course, it was mentioned that the mean duration for complete epithelial closure with the use of Wismet, okay, in diabetic group was 64.8 hours, okay, without using any sodium hyaluronate was actually 87.6 hours, up to 4 days. So what it means is that the use of with the use of sodium hyaluronate product, we can actually help your patient to achieve complete wound healing earlier. So reduce the risk of your patient's risk of endophthalmitis, because in normal clinical practice, it is mentioned over here. Most of the post-operative endophthalmitis, okay, will normally happen around 3 to 5 days after the surgery. So it is important to achieve complete wound closure before that, whenever possible, right? And apart from wound healing, okay, sodium hyaluronate, yes, we know, oh, good for wound healing. What about other properties? So this is another study looking at the cytoprotective effect, which is the antioxidant effect of hyaluronic acid. Of course, they look at carbomer as well in the ocular surface epithelial cell. So this is the outcome. They look at the reactive oxygen species production. Okay, it is not very clear over here. So look at the free radicals production. Okay, so as you can see in this purple bar, all right, it is actually benzalkonium chloride. So of course, benzalkonium chloride is a preservative which is known to have to cause a lot of toxicity. Okay, so you can see the amount of free radicals being produced is up to almost 160%, more than 160% of the control. Okay, however, all right, if you look at the other two, which is Wismet and carbomer, the light blue and the yellow, okay, you can see they actually have antioxidant property, as they are able to reduce the free radical level, okay, lower than that of a control, all right? And one interesting fact is that if you look at the green and the orange color bar, which is these two, okay, if you were to add Wismet or carbomer into the preservative, into the benzalkonium chloride, they somehow can actually reduce the toxicity or the toxicity of the preservative, the benzalkonium chloride. Okay, so with this, in the conclusion, they actually mentioned hyaluronic acid and carbomer have no toxic effect in vitro, but possess antioxidant property. And that these two hydrogel, when they combine with the benzyl ammonium chloride, can actually reduce the toxic effect of preservative. All right. So this is again an interesting features of our sodium hyaluronate. All right. Okay. So all in all, the benefits of sodium hyaluronate is actually summarized in this systematic review, right? A meta-analysis. Okay, where they mentioned that after collecting all the data, so they noticed sodium hyaluronate is able to stabilize the ocular surface barrier at tear film because they have this muco-adhesive property. They have anti-inflammatory effect, all right, as we have seen just now. They reduce the inflammatory mediators. They can reduce the friction between cornea and eyelids. And lastly, of course, the most importantly, they have this water retention property, right? All right. So our next discussion will be whether to choose a preservative or preservative-free formulations. Of course, given a choice, we will choose a preservative-free option. Okay. So this study to share, okay, which is by the test school. All right. They look at the comparison. They compare the effect of different eye drops, okay, in vitro rabbit cornea, looking at the cornea healing as well as toxicity. So this is actually a comparison, okay? So Vismet multi, which is our multi-dose, even though it's multi-dose, but we are preservative-free because our bottle is engineered in a way that is a filter, all right? So you can see with the use of Vismet, what they do is because they want to look at toxicity, right? They actually instill hourly, all right, and look at how's the outcome. This is by 3 days, all right? So you can see for Vismet, because it is preservative-free, so overall the epithelium, the stroma, everything is still intact, all right, in the cornea. And however, if you look at the BAC, which is the benzyl ammonium chloride, you can see the epithelium is compromised, okay, and there's a stroma edema as well, right, and as well as the endothelium. And with the use of product with preservative, okay, you can see the option, which is these three, okay. You can see that somehow the result is not consistent. Sometimes it's okay. Sometimes the epithelium or somehow is lost, and there is also slight edema as well at the stroma. All right. So looking at the wound healing, all right. So what they do is actually they induce wound on the cornea itself, and then they see how it heals. All right. You can see for Vismet multi, all right, the complete wound healing was observed starting from day 2. Okay, and of course, in contrast with the benzyl ammonium chloride, which actually has a horrible outcome. And however, if you look at the formulation with preservative, you can see like option 2, 3, and 4. You can see initially there is wound healing. However, the fluorescence staining somehow came back positive on day 5 and day 6. You can see here. Okay, and however, for Optic fusion, somehow because there's inconsistent result, that's why they show 2 different histology. Not histology, sorry. They show 2 different pictures. Okay, this is probably due to because with Optic fusion they have actually added the hyaluronic acid. So with hyaluronic acid, somehow they have a certain extent of protective effect. So but however, in that study itself, the outcome is not very consistent. Okay, so the author actually account this cumulative toxicity, which he said might be attributed to the preservative purine. All right, this is just to give you an overview. Of course, there are different products in the market with preservative as well. All right, and in this study, we all use the multi-dose bottle, not the single monodose. Okay, because monodose definitely there is no preservative. Okay, lastly, I would like to talk about the essential electrolytes. The electrolytes, most of the time we do not pay much attention on electrolytes because it's just electrolytes. Okay. However, they are actually pretty important. Okay, in the normal physiology. One of them is magnesium and calcium. Okay, if you look at this article, looking at the roles of magnesium and calcium in the cell to substrate adhesion. In fact, calcium and magnesium, okay, because they are positively charged, they are very important for cell adhesion, right? Because our ocular surface is negatively charged, Right. So in this case, it actually mentioned they enhance the cellular spreading activity, okay, by these divalent cations, which is the positive ions, and facilitate cell adhesion to negatively charged substrate. Okay, we want to bind to the surface, ocular surface. And secondly, on this T-Force used to management and therapy report also, it actually mentioned potassium itself is very important to maintain the normal thickness of the cornea. All right, and if you look at the bottom line, all right, over here, the epithelial surface is actually best maintained with a buffer solution containing first potassium, calcium, magnesium, phosphate, bicarb, and sodium chloride, with potassium being particularly important. All right. So interestingly, if you look at the composition of this mat, okay, we actually consist of sodium chloride, potassium, phosphate, magnesium, and calcium. All right. So it's actually packed with essential ions. And bear in mind, not all artificial tears in the market they have this composition. Right. Okay, so lastly, I will show some of our product profile, okay, before I end, okay. So this is Bismuth, okay, normally is for mild to moderate dry eye, comes in 0.18% of sodium hyaluronate. We have both single and multi-dose bottle. Our single dose bottle stability is 12 hours, meaning once open, okay, it can last up to 12 hours. Of course, some doctors may just advise the patient to use for a day, right, for economical purpose. And for our multi-dose bottle, because we have this special technology called ophthalmic squeeze dispenser, meaning the bottle itself actually is equipped with filter, okay, and tip seal mechanism. So even without preservative, it can last up to 3 months. Okay, so similarly, we have one which has higher concentration, 0.3%. Okay, and this is for moderate to severe dry eye. And of course, we also have the single unit dose as well as multi-dose bottle. And for the whole range itself, they are all preservative free. Okay, so just to recap, for the Bismuth range, first we are hypotonic. Okay, I believe not many products are hypotonic. So 150 milliosmol per liter. Okay, so as to address the hyperosmolarity in the tear. Secondly, our main ingredient is sodium hyaluronate, natural sodium hyaluronate, 0.18% for the Bismuth, and for the Bismuth gel, 0.3%. And we already discussed what are the benefits of sodium hyaluronate. And we are preservative free, so it's definitely compatible with contact lens use. All right. And lastly, we actually has these essential ions like potassium, calcium, and magnesium, which is very important for physiology. And last, oh yeah, last again. All right. So I was thinking what to show, what I can show that is more relevant to the situation now. Then that's when I came across a paper on this dry eye in the COVID-19 era. Okay, so they're actually looking at how the measures for controlling the pandemic might harm ocular surface. So in this, the author actually mentioned, because right now there's increase of smart schooling or working from home and so on. So individuals are exposed to high use of visual display terminal, laptops and handphones and so on. And there is excessive evaporation of tear attributable to the prolonged blinking intervals, while gazing is thought to be the main causative factor. And on the other hand, because of the mass use of mask, right, the displacement of mask or maybe incorrect fitting of the mask could disperse air around the eye, all right? And the air leaking could cause a rapid evaporation of tears. So with this, hopefully, all of us, we blink more, all right? Drink more water, wear our mask appropriately, all right? So as to protect ourselves from dry eye during this COVID-19, during this pandemic, all right? So these are my references, okay? And before I end, this is my last one already, really last one, okay? Because I came across this picture and I think it's a good metaphor for what I have talked about today. So for a patient with dry eye, the tear hyperosmolarity is something like this, okay? Like the first fish bowl, okay? So the fish are struggling, okay? It's like our epithelial cells. All right. So really, what they're looking for is something that is hypotonic. Okay, they're looking for survival, looking for something that's hypotonic. Okay, to help them in this concern. So please look for hypotonicity. Look for Wismet. All right. With that, thank you.
So again, thanks to TKSH and also TRB for very kind to support these seminars. And if you mind, I just make a conclusion of the two blog talks. Yeah, the most important conclusion I believe is don't forget your lunch is sponsored by them.